video camera for my house,
Yeah,
so I can just go
you should, man.
on social anytime.
It'll be a lot easier.
But this is good because
The phone is good video, though.
got a lot of
Yeah, that's good.
Let me turn my ringer off. You want to take your ringer off, Jess?
I just left mine in the other room.
And Jay, don't forget, you can refer to 311.
I can what?
You can refer the counties 311.
Yeah. Just dial 311.
Yep. Connie, do we know if that's open for more than just business hours at this point, or is it still just business hours?
I don't know.
I think it's just business
That's what I
hours.
like.
What the three
Yeah.
shot will be.
But,
The wide shot.
yeah, and the EOC is open too during the day.
Yeah.
Or they actually, wait,
Oh, the Jessica Snow
Is
one
there
is in
somebody
the
you want me to
seats.
call real quick to find out?
Just so you know the barrier.
Yeah, if you want to give a shout.
Yeah.
maybe Ryan
It's-
come in just a little bit closer to me. That's good.
852-4900.
Okay, bear with me for 30 more seconds, sorry.
All right.
4900.
Yeah. That'll get you through to the EOC.
So I'm probably going to read the executive order.
You can do that.
Just take just a tiny
Hi, it's the Lieutenant Southampton calling. Is the 311 call system 24 hours now, or is it still like usually at 5? Thank you.
So this is something. This is a emergency message.
Yes.
You ready?
Connie's just trying to get an answer on the 311 question.
Did she call 311 to get the answer?
No,
Yes.
just call the EOC.
Okay, I'm trying to pull up my emergency order.
Good enough. Thank you. Bye-bye.
Just a few more seconds. We're
It's
just
24
balancing
hours.
all the cameras.
24 hours?
It's 311 for 16 hours, and then it trips over to fire and rescue after.
The 311 rolls over?
Right.
Oh,
So
okay.
They said just say 24 hours.
Okay. So they can call that any time of the day now.
At some point, I'll have you on when things calm down, we'll have you on the regular show.
It's supposed to go tomorrow. Yeah.
We could do it tomorrow.
We're still booked.
Yeah. We could do it tomorrow. We can talk about other things other than, or we can talk about COVID-19 as well.
All right, I'm ready to roll when everyone else is.
Are they ready? They need
They said a couple of seconds. What's that? You ready? All set. They're all set.
Hello, this is Southampton Town Supervisor Jay Schneiderman. I'm joined by Southampton Village Mayor Jesse Warren and Ryan Murphy, our Director of Emergency Services, with an important message. So you're all aware, I know, of the spreading virus known as COVID-19. The town today declared a state of emergency to help facilitate response, so that I, as your town supervisor, can take all necessary steps to protect public health. I'd like to read that message to you, and then we'll get into a general discussion about some of the things taking place and some of the things we're doing at the village level and the town level. Of course, we're working very closely with the County Department of Health and with the State Department of Health and in consultation with the CDC, the Center for Disease Control. So this was issued today, the 16th day of March, 2020. The undersigned, as supervisor of the town of Southampton, pursuant to the authority by Article 2B, Section 24 of the Executive Law of the State of New York, has the authority to declare a state of emergency in the event of imminent danger to residents of the town. And whereas on January 30th, 2020, the World Health Organization designated the novel coronavirus COVID-19 outbreak a public health emergency of international concern. And whereas on January 31st of 2020, the United States Health and Human Services Secretary Alex M. Azar, II, declared a public health emergency for the entire United States to aid the nation's healthcare community in responding to COVID-19. And whereas on March 7th, 2020, by Executive Order Number 202, New York State Governor Andrew Cuomo declared a public health emergency as a result of the COVID-19 and further extended said emergency order number 202.1, 202.2 on March 12th and March 14th, respectively. Whereas on March 11th, 2020, the World Health Organization characterized COVID-19 as a pandemic. And whereas on March 12th, 2020, the Suffolk County Executive, Stephen Bellone, declared a state of emergency to address the threat to the health and welfare of Suffolk County residents and visitors posed by COVID-19 and to perform such emergency measures as deemed necessary. Whereas the town of Southampton is taking appropriate actions to minimize the threat from COVID-19 to the public health, safety, and welfare of its employees, residents, and guests, and whereas the supervisor, in consultation with the Town Code Compliance and Emergency Management Administrator and the Southampton Town Police Chief hereby finds that public safety is imperiled by an imminent danger exists. Now therefore be it resolved that pursuant to the powers vested in me by the executive law of the state of New York, I hereby direct the following, effective as of 4:30 p.m. on March 16th, 2020, and effective through March 31st, 2020. It is ordered that the following emergency order be hereby adopted and implemented. 1. The Southampton Town Supervisor, in consultation with the Town Code Compliance and Emergency Management Administrator and the Southampton Town Police Chief, is authorized to take whatever actions are necessary to protect life and property and public infrastructure and to perform other such emergency assistance as deemed necessary. 2. Town Hall and all administrative town offices, including but not limited to the Community Preservation Fund Office, the Town Clerk's Annex, the Parks Department, and the Highway Department, shall be closed to the public. 3. The regularly scheduled public meetings of all boards and committees, including but not limited to the Planning Board, the Zoning Board of Appeals, and the Conservation Board, shall be canceled. The town board meetings will continue as scheduled, though all public hearings shall be postponed. Said meetings shall be closed to the public, town board meetings will continue to be televised, and provisions shall be made for public comment. 4. All bid submissions and scheduled bid openings shall be postponed until further notice. 5. All recreational programs are suspended. 6. The adult daycare program is suspended. Residents are urged to utilize online services offered by the town and to utilize email and telephone communications in place of traveling to any town facilities. All credit card processing fees, charges shall be waived. In an effort to aid residents, document drops will be available during regular business hours in the lobby of Town Hall. This emergency order shall continue in full force and effect through March 31st, 2020, unless otherwise amended, modified, or rescinded, or upon the declaration of the supervisor that the emergency no longer exists, whichever occurs sooner. So that is the substance of the emergency order. I regret that it became necessary. I want to explain a little bit about why I felt that we needed to take these steps to minimize social interaction. So we all are aware of COVID-19. We're aware that certain populations are particularly vulnerable. We're also aware that it's spreading faster than our healthcare systems are prepared for. And by minimizing contact, social contact, we believe we can help blunt the speed or the acceleration of the spread of this virus and give our healthcare providers time to ramp up, to get the ICU beds established, to get the medicines that they need, to get the testing in place, to get the nurses and other medical support staff trained to provide daycare for those with young children who may have to be called into the hospitals or needed health professionals. So There is a lot going on here. We understand that government services are needed by many, and we are doing our best to deliver those services. So we are making provisions so, within the buildings that are closed, the town employees are going to continue to work. Applications will continue to be processed, but we will minimize social interaction and we'll provide numbers and contacts. We also will use Channel 22 frequently. In fact, I think there'll be constant messaging on Channel 22 CTV regarding the coronavirus, helpful numbers to call, any updates that we have, we will provide through our website and through Channel 22. The county already has an emergency in effect. So does New York State, and so does the federal government. The villages are also enacting similar emergency orders. I am joined today by Jesse Warren, who is the newly elected mayor of Southampton Village. We will have updates occasionally from other mayors as well, and use this tool through Channel 22 to reach out to you. A lot of people are going to be home during this, and that's where you probably should be for the most part. This is our way of reaching out and giving you important information. With that, I'll turn things over briefly to the mayor of Southampton Village.
Thank you, Supervisor Schneiderman. Thank you for having us here today. The Village of Southampton has also declared a local state of emergency. Now, all that means is that we have this in addition to the town, which we did it in tandem, and in addition to the county and New York State. The state of emergency has already been in place. And so this just essentially allows the executive to have more authority in the case that it is needed. So far, it is simply precautionary in the case that we need to take extra steps, but we have it just in case. So this might help in the sense of procuring goods, if we need to secure a parcel of land, but in essence, we are already protected by the county and state levels of state of emergencies. A few other quick announcements for the village. We have closed Village Hall to the public. Our village employees who are comfortable coming to work today are working. Those who want to work remotely will do so, but all of your services will be provided to you via phone and via email and via messaging. So don't hesitate to reach out to our village. We are there for you, but we also are going to be working remotely for those employees who would like to do so. Our land use boards, in a similar fashion to the town, our ZBA, Planning Board, and ARB, will also be postponed for the next 2 weeks, and we'll get back to you as soon as we have an update on that. Our facilities, such as playgrounds, for example, are closed. We are doing that out of, as we've been hearing the phrase, out of abundance of caution. We'll be following that phrase. The reason is that we want to minimize all exposure to all levels, whether it's children or seniors. We want to make sure that exposure is limited. You also may have heard about the phrase flatten the curve. That is a widely used phrase right now, and the meaning of that essentially is that the less exposure that you have and the less you're exposing others, the better chance we have right now of containing COVID-19 or the coronavirus. So not just as mayor of the Village of Southampton, but as a person and as a business owner, I would encourage everybody to stay indoors when they can, to avoid public places when they can, and to practice social distancing and to wash your hands. You have probably heard this in repetition at this point, but it cannot be repeated enough. The more we do this, the more we get ahead of this, and the more we minimize our chances of this spreading even further. And in addition, we buy our county, our state, and our federal government and the CDC just a little more time for them to do the work that they need to do in order for them to come up with solutions on a national level and at a state level to these problems. For those who are watching on CTV, I do regular social media updates on my Instagram page at Mayor Warren, and I'm providing just real-time updates as to what is going on. You'll be able to just see exactly what's going on when it happens. In addition, I believe the town has this as well, but our Village of Southampton has rolled out our Code Red program. You can go to the App Store and you can go download the app. You can go to the Code Red website simply by texting the phrase Southampton to the number 99411. So again, text Southampton to 99411 and you'll be enrolled in our Code Red app and web-based program, and then you'll get real-time updates from myself and from our police department and emergency services. And that is, if there's anything we need to tell you, we'll let you know. And lastly, and before I pass this back to Jay and other colleagues here, is that the governor issued an executive order closing all restaurants except for takeout, all places with capacity or limiting capacity to 50 people or less. And I do want to let the public know that this is essentially going to be enforced by our village police department. We want to take extra precautions. We will follow the executive order passed down by the governor, and we hope that we can be as helpful to the town and to the state as possible. And so with that said, I'll turn this back over to Supervisor Schneiderman, and thank you for listening. Feel free to reach out to me anytime if you have any questions.
So let me just pick up on that last thought about the restaurant. So the newest order is now takeout and delivery only, I believe, right?
That's
starting
right.
Starting tonight?
Correct. At 8 o'clock.
Starting at 8 p.m. tonight, all restaurants, there'll be no indoor dining. There'll be only takeout and delivery, and that's restaurants throughout New York State, correct?
That's correct.
We are taking this seriously, as is the governor. We understand that this may be an inconvenience, some of these things, but if somebody contracts this and it causes their death, if we can help prevent that, I think it's really important. And if we can allow time for our health providers to better prepare for the increased caseload, then I think we'll have done the right thing. I'm going to turn things to Ryan Murphy, our Director of Public Safety, to give you some guidance as what you can do to help avoid COVID-19 and just to update us on any other issues related to the spreading virus.
Thank you, Supervisor. I think that the messaging that we'd like to make sure that everybody continues to receive is really what we've been putting out there all along. Hopefully people have been paying attention to the town's messages, which are very similar to the state and county, and that we're strongly encouraging good respiratory hygiene, making sure that people cover their coughs and sneezes. We're encouraging, as the mayor and the supervisor both have talked about, frequent hand washing. If you don't have a capability to wash your hands wherever you are, utilizing some sort of a sanitizing liquid is always another option that you can use, but preferably hand washing. And most importantly, and that's why a lot of these measures are being taken, social distancing. Maintaining at least that 6-foot space between you and other people, avoiding crowds and crowded facilities. A lot of the measures that have been implemented in the last day or so by the county and the governor's office are being done for the exact same purposes. As the supervisor and mayor both just mentioned, we want to slow the transmission of COVID-19 within our different communities, to try and allow our healthcare system to keep up or catch up with the spread so that we don't overwhelm that system. This is an evolving situation. Hour by hour, we're getting more information. As testing becomes more available, we can certainly expect to see more confirmed positives within the county, within our township area as well. So we know that this is something that we're going to face. We know that this transmission is occurring countywide. As of last night, none of the confirmed positive cases within the county of Suffolk were people that had traveled. This is all being pushed around through community spread. So we know that it's out there, and that's what we're trying to get ahead of. If it's being transmitted through community spread, the best way to deal with trying to slow down community spread is to avoid having people gather and assemble in large crowds. So that's why some of these limitations are being put in place. This is a evolving situation, and we are doing our best to get out in front of it and stay ahead of it, and trying to slow things down. And really, it cannot be done unless each individual resident out there takes personal responsibility and ownership over implementing a lot of these strategies yourself and within your own family to try and slow down the spread.
I want to point out too, besides CTV, we will be using the town website. There's already notices on the town website that you may find important. We also have the Notify Me system, so you can register there just, similar to the Villages system, so you can get updates via text or phone call, and we can help keep you informed. So please visit the town's website and sign up for those programs. I also want to point out again, too, some of the things that are open still, the transfer stations. We understand that, people are living their lives and need places to bring their garbage. So we do have our transfer stations. They are open. We're not planning on closing those stations. Our parks do remain open. Please maintain social distancing, but getting some fresh air is probably a good idea. Our senior meal program, we are delivering meals to those seniors who are signed up for that program. So instead of coming to the senior centers, which will be closed, the program will continue. And our senior transportation, if you need a trip to a doctor's office, we can provide those as well. So please take advantage of those things. At Town Hall, though it'll be closed to the public as well as other administrative offices, the town employees will be working inside, and you will be able to drop documents off. We have a box here in the lobby of Town Hall. It's a secure box where you can come during regular business hours. If you need to get let's say, pay your taxes, you'll be able to use that box to do so. And if you need to contact one of the departments, you can easily use your phone and make that call, and somebody can help you via telephone. So this has sort of kind of crept up on us almost unexpectedly. I've been in government for 27 years now. I've never seen something quite like this. There's no, no playbook. So we're doing the best we can, trying to make fact-based decisions and act accordingly. Those facts seem to change daily, sometimes by the hour or even by the minute. Where we find out of another travel restriction or another reduction in social gathering places. So we are doing our best as governmental leaders to keep people safe. That is our job, and work with these other agencies, the county and the state and the federal agencies, to reduce the incidence of this virus. And it may get worse before it gets better. It likely will get worse before it gets better. We've had an influx of people, and I'm sure the mayor can attest to this, for people who are trying to get out of New York, and they're going to their summer homes. And I hope that they exercise caution, because some percentage of that group may contain or may have the virus. So for most people, this virus won't be a serious threat. But a sector of the population, particularly over 65, particularly over 70, and those with respiratory issues or immunodeficiencies, this is a very serious problem, and the mortality rate is much higher in that group than the others. Jesse, did you want to say anything about people mingling around the downtowns and precautions people should take? And of course, people are going to want to get out of their houses, but they really need to be careful.
That's right. So I actually wanted to thank the governor for the executive order that he passed, limiting gatherings to 50 people or less with the closure of some place. I think that sends a grave warning as to the importance of the self-isolation and social distancing that's needed. I also wanted to thank him for what he did over at New Rochelle, where he contained a cluster and a population there. And I think by doing so, he probably saved a number of lives by containing the spread there. And we're awaiting more information from the governor and the county executive. As far as our village goes, as I said earlier, please, if you don't have to leave your home, don't do it. It is better to stay at home with your friends or family. If you are a senior, the town has a meal program, as Jay pointed out. It's a great program. I know that many people in the village have reached out to me and have wanted to volunteer. And so, Jay, if you need any help, we have volunteers, not just throughout the village, but throughout the town, that would be helpful in any way to our senior population. And the reason why we're doing this and asking people to self-isolate is because we are trying to protect the senior community. So if you're at home and you're a senior, as Supervisor Schneiderman said, you should stay at home. If you're younger, you still should stay at home, but your immune system is stronger and you can handle it. But we are simply doing this to not only contain the virus, but mostly to protect the older population. And to reiterate what Dr. Piggott said on our call yesterday that we had, Dr. Piggott is the Suffolk County Commissioner of the Department of Health. There were 48 cases, positive test cases as of yesterday. Now that's going to increase. But ultimately, there are more cases that are positive. We just don't know about them, according to Dr. Piggott, simply because there is not enough testing available. But, and again, feel free to jump in any time here. We are in close contact with the hospital, and I spoke to Robert Ross, who is head of public relations and community relations at the hospital. According to Mr. Ross, the hospital, as of now, is in good shape. After speaking to some other physicians, proportionately, we have more respirators in this area than maybe other parts of the state. Still not enough, so that's why you have to contain. But the hospital is in good shape as of now. They're practicing all the best practices, and there's potentially a triage set up at Parish Hall. So the hospital, again, we can't really speak for them. We can only communicate information we have been given, but the hospital is doing everything that it can. But again, our message to you, if you're tuning in, is you are dramatically lowering your risk profile if you decide to stay inside and practice social distancing and avoid public places when you can. And that is the number one concern right now. So you can reduce your risk profile simply by doing that. I don't want to take any more of the time. I'm happy to continue to go on, but
I think you're making good points. And people, please don't be naive and think just because we're in a less populated area out here on the East End that coronavirus isn't here. It is here. And the testing, as they ramp up, we're going to find that there's more of it than we realized. We now have 2 positive tests within the town of Southampton, one in the Hampton Bays area and one in the Southampton area. I don't have greater detail on that, but there's going to be more positive cases. The North Fork has quite a number of cases. Last I checked, it was around 20 cases, and I'm not sure how their hospital is faring over there with the Peconic Bay and with the Eastern Long Island Hospital. But some of that may end up coming to Southampton Hospital as well. So we're all going to work together to give people the health care that they need. I do have a report from the college on the quarantined students. There's 26 students that have been quarantined up at the SUNY Southampton campus, SUNY Stony Brook Southampton. None of them are showing any signs of coronavirus, and they're all still there. They're running down their 14-day clock, but so far there's no signs that any of those students have the symptoms of coronavirus. We get calls, Mayor Warren and I are on the same call with the county executive pretty much every afternoon. Ryan, I know you've been on that call as well. We're trying to have a coordinated effort. There's obviously lots of questions that come up, but we're doing our best to to get the answers best we can. Ryan, go ahead.
Yeah, and within 2.5 hours after the call yesterday, the county confirmed numbers had gone up by 12 people. So we ended our call, and it was at 48, and within 2.5 hours, it was up to 60. So just to give an idea, and really, we want to make sure that nobody is minimizing the effect or the threat of this viral, transmission out there. It needs to be taken seriously. There is definitely community spread going on, and if we don't take these actions, it will continue to persist in that fashion. So it's those numbers are going up, and we all need to do our part to help get them down. You mentioned, Supervisor, the students at Southampton campus, but also we have received some very favorable and positive reports from our colleagues at the hospital with regards to the first individual that had gone over to Southampton Hospital, that thankfully his recuperation seems to be going quite well so far. This obviously is a more threatening illness to the over 65, over 70 population. As you mentioned, there could be people walking around today that have it, depending on how mild the effects are. Young children can serve as quite the vector for transmission of the illness, and because they they have experienced so many different colds that affect them being in school and around other kids, and they seem to kind of get passed around. Some of them have built up a bit of a systemic tolerance for it so that they don't see the effects quite as much, and it almost might seem that it's manifesting itself as just a regular cold, but they could very easily help pass from person to person to person. So even within a family, you'd want to take considerations and take steps where you may not want to gather with the rest of your family right now, and really try and stay isolated so that young children aren't being mixed with senior members of the household, so that they or senior members of the family, so that you don't stand this chance of passing from one to another even. Not just outdoor and enclosed space, large social gatherings, even just amongst family members themselves. Whatever you can do to try and isolate yourselves a bit during this time period is definitely a great precautionary step to take.
I want to mention Suffolk 311 because this is a 24-hour-a-day number that you can call. It's just 311, the same way you dial 911 in an emergency. Suffolk 311 for residents who have questions about symptoms, travel concerns, or tips on preventative measures you or loved ones can take. They can visit the Suffolk County website as well. So that's www.suffolkcountynY.gov. They have a lot of helpful information there. And just some guidance, some facts that the county executive and Dr. Piggott put out. Obviously, wash your hands often with soap and water for at least 20 seconds. Use an alcohol-based hand sanitizer that contains at least 60% alcohol if soap and water are not available. So soap and water is better than these Purell or other types of hand sanitizing products, but at least the Purell, you can carry around with you. Avoid touching your eyes, nose, and mouth with unwashed hands. You've heard all this before, so I'm just repeating it. Avoid close contact with people who are sick, obviously. Stay home if you don't feel well. Cover your cough or sneeze with a tissue. They say to cough into your elbow, right? Then make sure that the tissue goes directly into the trash. Clean and disinfect frequently touched objects and surfaces. So you're going to hear the same sort of guidance and advice from many different sources. And we're going to do our best to keep you up to date. Stay on Channel 22 when we're going to constantly give information on what's going on in the coronavirus, with the coronavirus. There'll be occasional live broadcasts and various shows that we broadcast, all related to the coronavirus pandemic. Anything else either one of you want to say before we go off?
No, I think we've also linked to a lot of that information too off of the town website. So if you go to the town website, you can find any of the releases that we've put out to the public, and links to a lot of that county information available too through the Southampton Town website as well.
Anything else, Jesse?
The only thing I would add to those watching here is that, unfortunately, we are in the very early stages of the situation, and we're going to do our jobs to over-communicate as much as possible and to keep everyone updated real time. But the reality is that at the early stages of any situation, you'll typically find that communities come together and we all work together and we do all the right things. And I would like to make sure we continue to do that, and please keep that in mind. Whether it's you're shopping for groceries, leave something for somebody else, volunteer and help. But as situations like these progress, what we've seen historically is that sometimes people will then put their community mindset second and put fear first. But we want to make sure that that doesn't happen. So continue to be mindful of your fellow residents and community members. There is really no place and no reason to be fearful, simply because you can avoid this altogether by staying inside and isolating yourself. And I don't have as much experience as Supervisor Schneiderman does and other elected leaders, but I do have enough studying of history, and I do have enough time under my belt to see other crises happen. whether it's the financial crisis we experienced in 2008, or whether it's the depression that we experienced in the 1930s. And I just would close with the quote in FDR's inaugural address when he said, "There's nothing to fear but fear itself." And that actually rings true, because ultimately there is nothing to worry about. We will be okay, but just follow these basic steps and you have reduced your risk profile. So keep your community members in mind. Always keep that first and foremost. Don't be overcome by any worries, because there isn't that much to worry about except protecting your friends and family, and by following these steps. Everything that follows will follow. We'll get through it all. We've gotten through all of this historically in our village, in our town, in our country in the past. We'll get through it all. Right now, just focus on the near term, which is make sure you're practicing the basic guidelines that our town and health departments have provided us. So thank you again for the opportunity to speak.
No,
to
and that's
today, Jay.
important, Jesse, and it's not just about an individual avoiding getting coronavirus, it's also the person they might give it to if they get it. That first individual might weather it without a problem, but a senior over 70 who gets it might not fare as well. And we have to think about this as a community response, and not just think about ourselves. And we may be young and strong, but we could spread it to somebody who is not. So I think it's really important that you heed the advice that we are giving you, that the county and state and the federal government are providing. This is a very, very serious matter. We do not want to minimize it in any way. In closing, please heed the advice. Please be safe. Really think about yourself, but think about everyone else. Do what you can to prevent the spread. And we will get through it. Mayor, did you want to say anything?
No, I think you've covered it all, and I think if people have any additional questions, they can certainly visit our website and or call the 311 number and get the information that, the most current information available that we can put out there. It's an evolving situation, so we're just trying to stay on top of it and make sure to convey that to the people.
And again, just every once in a while, go back, check Channel 22. We'll be putting updates there. Check the town website, and sign up for the Notify Me system or the Southampton Village system if you're in the village. And we'll do our best to keep you notified. So thank you and be safe.
Thank you.
Thank you.